The Accra Metropolitan Assembly has also buried 4 people today who died of coronavirus. Joseph Asitanga is an environmental health worker with the Accra Metropolitan Assembly. He will be joining us subsequently. We'll take an important look at this and get to know what the numbers are. But before then, we have to go to Dr. Michael Owusu, who is a regular contributor on programming on the Joynews channel. And he is a virologist with the KCCR, and the KCCR stands for the Kumasi Center for Collaborative Research. Now, good evening to you, Dr. Michael Owusu. It's important that we have you right here. The concerns that have been raised across the board, especially by Dr. Bonnie from Noguchi, also means that we're in for some serious shake-up or trouble. Is that how, as a virologist, you also have observed the situation?
Yeah, good evening to you, and good evening to all your viewers. I don't think we are in for a shake-up or trouble. I think that we may have this difficulty for a short period of time, but then it's possible in the coming weeks we may get the necessary reagents to enable us test as much as we can. I mean, the point is that because of the changing dynamism of the virus spread and the increasing transmission rates, there seems to be huge demand on testing, which will mean that more logistics is being demanded across board for the different testing sites. And of course, when you put in a request for these logistics, it takes quite some time, and we don't manufacture them in Ghana. And most of us either import from Europe or in Asia or America. In America and Europe, some have placed embargoes on export of their kits to Africa. The Chinese are quite liberal, and therefore most of our kit that we are using seem to come from China. Even for them, there's a huge demand for this in North Africa, and especially in South Africa, where they are recording quite a significant and huge number of cases. So we are all competing for the same market sources for these reagents and these test kits. So as the cases increase and the demand for testing increase, we may run into this difficulty. But I think that this will be for a short time, because I'm aware that the government has placed a request for this, and it's possible in the coming weeks we may get some more reagents to enable the different sites to begin testing.
Now, you just stay on the streams and then let me get onto the phone lines and speak to Mr. Joseph Asitanga. He is with the Environmental Health Department of the Accra Metropolitan Assembly. I know that you supervise the burial of at least 4 patients of COVID-19, or 4 people who died from COVID-19 related illnesses. Have we had increment in the numbers based on the burial rates you've had over the last week or 2, or even this month?
Have we had increment in the numbers week or 2, or even this month?
Good evening. Good evening to your listeners.
Okay.
Okay. Is that okay?
Right. Please, you can go ahead and respond to the question.
Yeah, good evening to your listeners, and good evening to everybody. COVID-19 has come to beset us into a trouble of challenge. We are all trying and struggling to come out with it. The death rate and the burials that we are undertaking, a lot of the burials are yet to continue. And every day, the timetable withdrawn for the burial per week is supposed to have been twice a week. But the work has been so tedious that I have to devise a method of, we reduce it to 1 day burial in a week. But we have emergency burial. Sometimes when we come to our brother and sister Muslims whose bodies are not to stay a day or 2, we have to call emergency burial to take care of such bodies. So the numbers are there. The death rate is there. It's in numbers. If you go visit the mosques that we take, we have them there. All the mosques that we go, Rich, 37, Kolibu, the East, the numbers are there.
Okay.
So to give a specific number, I've not gone for that data that I can be sure.
Yeah, because on the national data, we're told that we have 117 deaths so far, unless perhaps you have more numbers to bury.
Yes. We we have more numbers to bury. And if that is the national rate they have given out, that is what the results has confirmed. That they have all died of COVID, but we have others who are also have passed on, and they are waiting on their results to come to confirm that they have also passed on through the COVID.
Okay, let me ask you this question before I get to Dr. Michael Owusu. The burials that you have been supervising, are they only related to COVID, or you supervise other burials? Yes,
no. We are in charge of all the public cemeteries. The environmental health department is responsible for managing all the public cemeteries. And for that matter, within the public cemetery, we have earmarked a particular area specifically for the burial of infectious disease that might have resulted the cause of your death. So if you die out of an infectious disease, it becomes the responsibility of the environmental health officer to handle safely, bury you safely at the infectious zone.
Do you have? I see pictures of your personnel taking a body to go and bury, and yes. But the question then will be: do you have every PPE available for you?
As for PPEs, we have been provided enough of that of the PPEs for responsible for the burials.
Okay.
We are okay with PPEs for the burials. We still need more, but what we have now can contain what we are doing now.
All right. Just hold on for me. Let me ask a question or two. Dr. Michael Owusu, if you look at the outstandings or the backlog of samples that need to be tested, it's in excess of 7,000. Now, the period when you get results, according to what the experts have told us, your colleagues, is also getting longer because of these backlogs. What happens to those people whose samples have been taken and ultimately may test positive, and they live in the communities?
Well, it's a challenge, which is why we always keep advising people to adhere to the protocols. Because as for now, whoever is around you, whether it's your friend or your colleague, consider the person as being positive for COVID and put on your mask and practice social distancing so you keep yourself safe. So if you don't do this, then of course you put your lives at risk and also put the lives of your family or your colleague, friends, your wives and children also at risk. So we hope that when we get more reagents, we'll be able to further go back and process these samples as quickly as possible. I hope this will be just for a short time because these reagents have been procured, but maybe it's delaying. But as if your sample is collected and you're waiting to be tested, you don't just have to do anything. Put on your mask and just remain safe so that if it comes and you are positive, and if somebody is around you, you don't infect the person, and whoever is around you also doesn't get himself infected. It's a difficulty we have to go through, and this is some of the things that comes with us. And it's not only Ghana, but in many countries that have gone through these phases of COVID, they also in the acceleration phase when you have increasing number of people who are infected, especially when you have a huge number of asymptomatics. Right. These are things that occasionally happen, and you have to find ways and means of dealing with it. And for me, once you are adhering to the protocols, you have a chance of at least not becoming infected or for protecting others from becoming infected.
Well, thank you very much. And Dr. Michael Owusu is with the Kumasi Center for Collaborative Research. We'll be joining me and Mama Vioso tomorrow on the AM show right here on the channel. Make sure you join us then. It will be from 6 to 9. Great show it is. So